In 2017, 250,000 people were using residential care, home care or transition care within Australia. Aboriginal and Torres Strait Islander people accounted for less than 1 people in the residential aged care. This community lacks accessibility to services for health and welfare and is on the receiving end of multiple social disadvantages. So what does aged care look like for this community? In order to provide support and advanced aged care facilities to the community, the National Aboriginal and Torres Strait Islander Flexi Aged Care Program was designed in 2015. The program aims to provide flexible, culturally appropriate aged care to Aboriginal and Torres Strait Islander people. Potential recipients can access the program via their My Aged Care portal. The My Aged Care portal provides access to the highest standards of care guidelines set out by the Aged Care Assessment Team, or ACAT. The multidisciplinary team, consisting of social workers, nurses, occupational therapists, and healthcare practitioners, guide the individual towards the best avenue for future care. Presently, within Australia, there are 2,423 aged care centres providing support to the Aboriginal and Torres Strait Islander communities in Australia. One key organisation that supports the Brisbane community is the Jimbelunga Nursing Home. Home to 74 residents, the facility provides round-the-clock medical support for older Indigenous and non-Indigenous persons. Residents gain access to a laundry, kitchenette, all meals are provided, and are not shy to a barbie in the yard. Under the National Flexi program, residents receive access to personal services, support services, rehabilitation therapy, physical and emotional supporting treatments. All services are provided to the residents at government-determined fees that are transparent, accessible, and fair. Services such as Jimbelunga are a step in addressing social determinants and inequalities of aging Australian Indigenous persons.
Social determinants of health such as socioeconomic status, education, ethnicity, and many others shape our lives from conception to old age. Indigenous populations in many countries, including Australia, experience other determinants of health due to dispossession, depopulation, and disintegration, as well as culturally based determinants such as community connection and identity. Indigenous Australians who reach old age are arguably the most affected by social determinants of health, experiencing the culmination of a lifetime of social disadvantage. This affects both physical and mental health and is reflected in the disparity in life expectancy between Indigenous and non-Indigenous Australians. The most recent data available showed the life expectancy gap to be 11.4 years for males and 9.5 for females. Furthermore, while 15.9% of non-Indigenous Australians are aged 65 and older, this same bracket represents just 4.8% of the Indigenous population. Indigenous Australians face higher rates of chronic illness and of disability requiring support with core tasks, with 88% of Indigenous Australians aged 55 and older living with long-term health conditions. Despite these higher care needs, less than 1% of people living in permanent residential aged care identify as Indigenous. This small group is also significantly younger than their non-Indigenous counterparts. In 2008, the Closing the Gap framework set the target of closing the life expectancy gap within a generation and committed to continuing efforts to lift the standard of Australia's Indigenous health and aged care services. That same year, the government also announced a $46 million Indigenous aged care plan to support various programs, plans and services. However, as of the Prime Minister's report 2018, the target to close the life expectancy gap was not on track.
Challenging racism and health inequality of Indigenous Australians is needed in policy and legislation. Older people have a vital role in the identity and continuation of Indigenous communities and are integral to the distribution of knowledge, stories, practices and traditions. Australian laws and policies of the past have resulted in chronic displacement and institutionalisation, leaving behind trauma-inflicted Indigenous people and communities. Services like Jimbelunga is a step towards quality care for older Indigenous Australians and reducing the gap by providing culturally appropriate and sensitive aged care services. However, more is to be done. The UN International Convention on Elimination of All Forms of Racial Discrimination is upheld by principles of dignity and equality that provides all people legal protections from discrimination as a basic human right. The National Anti-Discrimination Strategy 2010-2020 also aims to challenge, prevent and reduce racism within Australian society by addressing racist perceptions and attitudes existing in the Australian population impacting the treatment of Indigenous Australians in this nation. The aged care sector is transitioning towards person-centred care and enabling older Australians more choice and control. However, we need to be accountable for developing quality and dignified services that meet the diverse care needs of all people, especially older Indigenous Australians. The Aged Care Sector Committee Diversity Subgroup developed the Australian Aged Care Diversity Framework in consultation with Indigenous communities, consumers, providers, peak bodies and the aged care sector as a timely and important step towards inclusivity of diversity in aged care. The National Aboriginal and Torres Strait Islander Health Plan 2013-2023 aims to improve Indigenous health across the lifespan by addressing racism and inequality through 4 core principles: health, equality and human rights approach, Aboriginal and Torres Strait Islander community control and engagement, partnership and accountability. Healthy ageing is one of the goals of the plan, stating that older Indigenous people are able to live out their lives as active, healthy, culturally secure and as comfortably as possible.
In devising recommendations, we would like to note firstly that Jimbelunga practices in a way which is often consistent with our own recommendations. Jimbelunga, however, is relatively unique within the local aged care sector, and much of what we recommend is applicable to the broader aged care sector. Our first recommendation concerns asset-based community development. Asset-based community development maps the strengths and capacities of service users and is the focus on capacities which forms the foundation of service delivery. This approach can improve aged care service delivery for Indigenous people in a number of ways. For instance, it helps to ensure aged care services are delivered in a way consistent with a human rights approach. Using asset-based community development helps to build the agency of Indigenous service users, and importantly, it can assist to remove the racism and inequalities present in the broader aged care system. Another recommendation is for all Indigenous Australians to have access to community-controlled aged care services. Community-controlled aged care services allow Indigenous users to be actively involved in their own care and to be able to direct that care according to their needs. Community control allows for Indigenous people to exercise their right to self-determination. It allows for the inclusion of a holistic definition of health and of health service delivery. It helps to align services provided to the needs of Indigenous service users. It helps to foster and improve culturally appropriate care, and it promotes partnership, engagement and accountability within aged care delivery. Our final recommendation is that Indigenous service users be provided with professional assistance to navigate the ACAT system. This can be achieved by providing the aged care workforce with education and training. The aged care system in its current form is a complicated system. Navigating it requires a level of complexity which prevents many people from effectively accessing services. Providing assistance to service users to navigate the ACAT system would help to break down barriers of access. It would increase the autonomy and choice available to Indigenous service users. It would build the capacity of both service users and the aged care workforce, and would help to increase Indigenous inclusion within the aged care sector.